Allison Chabio, and this is my final head-to-toe assessment in our 6:30 advanced health assessment. This is Katie, my patient, and Katie, if you have any pain during this assessment, please let me know.
Okay.
And I'm going to wash my hands real fast. First your hands at a time. Okay. I am going to start by taking her blood pressure and reviewing her vital signs. My hands are cold. Yeah, right. Blood pressure is 110/67, and her yeah. Her pulse is 67. I'm going to now inspect her skin. Her skin is pink. There is no bruising or trauma. There is no lesions, rash. The skin is warm and moist. It is smooth to texture. The skin turgor is normal as it goes back to normal position briskly. I'm going to now assess your eyes. The eyelids are symmetrical. There is no drooping. Eyebrows are even. The eyelashes are evenly distributed. I am going to test your 6 cardinal directions of gaze. So I'm going to have you follow my finger without moving your head, with just your eyes only. And now I'm going to have you look at my finger, and as I move towards your nose, just keep your eyes on my finger. The extraocular motions and the convergence is normal. I'm now going to assess your pupils. The sclera is pink and the sclera is white and the conjunctiva is pink. Right light narrow here. The pupils are symmetrically round. They are 3 millimeters and they constrict to 2 millimeters with direct and consensual light. Now I'm going to look inside of your eyes. The red reflex is present. The optic disc margins are sharp. There is no exudates or hemorrhages, and there is no AV nicking. I'm now going to assess your ears. The external ears, the auricle is intact. There is no nodules, polyps, or lesions on either one of the ears. There is bilateral piercings in the earlobes. And I'm going to assess your hearing acuity. So I'm going to do a whisper test. I'm going to have you cover your left ear, and I'm going to say a series of 3 letters or words, or 3 letters or numbers, and I'll have you repeat them back to me.
67.
Hearing acuity in the right ear is normal.
A to B.
And hearing acuity in the left ear is normal. I'm now going to look into your ears. The external canal is free of objects. There is no redness or drainage. The tympanic membrane is a pearly gray color with the cone of light is present. It is intact without perforation. The malleus is midline, and there is no bulging or drainage of the tympanic membrane. I'm now going to look into your nose. So I'm going to have you just extend your head a little bit so I can look up to your nostrils. The nasal passages are patent. There is no polyps, nodules, or lesions. The turbinates are reddened and they are moist. The septum is intact and without deviation. I'm now going to assess your mouth. The lips are pink and moist. There is no cracking, ulcers, or lesions. And I'll have you open your mouth for me. The mucosal membrane is pink. The tongue is moist, and there's no white patches. And I'll have you say ah.
Ah.
The soft palate rises, and the uvula stays midline, which indicates an intact cranial nerve 10. I'm going to assess her sinuses. Let me know if there's any tenderness. Any tenderness?
No.
There is no tenderness in her frontal or maxillary sinuses. I'm now going to palpate for her lymph nodes. The periarticle, postarticle, occipital, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. And none of these lymph nodes are palpable. I'm now going to have you clench your jaw, and I'm going to test for cranial nerves 5 and 7. So I'll have you clench your jaw. The temporal and masseter muscles have good strength. They're a 5 out of 5. I'm going to have you move your jaw side to side like this. Okay, and now I'm going to have you raise your eyebrows and smile and puff out your cheeks. Cranial nerves 5 and 7 are intact. I'm now going to have you shrug your shoulders against my resistance. Okay, and I'll have you look in this direction and move your head back to midline against resistance. Okay, and the other side. Good. And cranial nerve 11 is intact. I'm now going to assess your neck and your thyroid. Carotid pulses are 2+.